The American Public Health Association is committed to improving public health and achieving equity in health status. This year, we are incredibly excited to welcome all our members back, virtually and in person, to Denver to share the latest in research and public health leadership. This is APHA TV. Welcome to APHA TV for our last show this year. We've heard from some of the very best in public health research and policy, from equity in cancer treatment to violence prevention, revitalization of neighborhoods to rural health care. But there is still plenty more to come. We talk about rural public health and APHA's 150th anniversary with APHA's incoming president, Dr. Kaye Bender.
Our public health system matters, and we have work to do to rebuild it, to revitalize it.
A look at national centers working towards health equity. Mental health and disasters with Dr. Annelle Primm.
I think it's really important after a disaster to maximize mental health by employing 5 main elements.
And be sure to join the closing general session speaker, David Satcher, on achieving equity.
One of the greatest challenges is making sure that we keep generating interest.
Don't forget, all scientific sessions were recorded and will be available for viewing within 3 days of the annual meeting. Now, over to you, Dina.
I now have the great pleasure of being joined by incoming APHA President, Dr. Kaye Bender, as APHA celebrates 150 years. So many great accomplishments, but a lot of work ahead. So what are your goals in your presidency?
Well, thank you. It's great to be here, and I am so honored to be the president of APHA during this special year. Our public health system matters, and we have work to do to rebuild it, to revitalize it, to really encourage the students that are coming in, graduating and coming into public health, that it's a great profession, it'll serve them well. All of that while we're also strengthening APHA. We're doing some work to strengthen our member engagement, to lead the way toward work on equity, diversity, inclusivity, and now adding justice to that.
I know your entire career, you've really been passionate about health disparities.
Yes.
And working in Mississippi versus working, say, in Washington, D.C., you really have a great sense and focus on the difference between rural and urban areas. In pandemic and otherwise, what are some of your major concerns there?
Yes, 1 in 5 Americans live in a rural area, but not a lot has changed in terms of access to health care, in really addressing food deserts. And in my home state, food deserts are a huge problem because a lot of the small areas don't even have a grocery store. But I think it's time for us to really stop talking about and accepting that rural is rural, and so we shouldn't accept that because of that, it's okay to have these disparities.
I want to get back to COVID, and we've talked about the challenges and some of the real negative things that have come of this, not the least of which are all of the deaths. But are there lessons learned where there could be some positive coming from this pandemic?
Oh, absolutely. I think telehealth is probably, in my view, one of the best lesson learned. I think we've also learned in public health that while it saddens me that a lot of the public has decided to mistrust government, what government has to do then is to really leverage the partnerships that they have for trusted messages. I hope the trust in government returns, but until it does, I think another lesson learned is those trusted partners.
So made some progress, certainly, but a lot of work ahead.
Absolutely.
Wishing you success ahead as APHA President. Kaye Bender, thank you so much.
Thank you very much.
APHA TV is brought to you from the 2021 APHA annual meeting. You can find us in person at the Colorado Convention Center, in select hotels, and on the homepage of the meeting platform, as well as on our YouTube channel and Twitter feed.
Dr. Annelle Primm is here now to talk about natural disasters, especially climate change, and how they uniquely impact Black, Indigenous, and other communities of color. Thank you so much for being here.
Thank you, Dina, for having me.
So I want to talk about the focus of this year's conference, and that is strengthening social connectedness, and how that is so interwoven with mental health.
You know, I think it's really important, especially in this time with COVID-19 pandemic, and how many people were saying in order to protect yourself, you need to socially distance. But many of us in the mental health community have advised against using that terminology, and instead we suggest that people physically distance because we need to be socially connected. The social connection piece is really critical to our mental health.
What an important nuance. Physically distance, don't socially distance, because in pandemic we saw mental health issues rise exponentially. We saw substance use issues. So can you talk about natural disasters and how in the wake of that we see increased anxiety, PTSD, depression? How might we mitigate those?
I think it's really important after a disaster to maximize mental health by employing 5 main elements. Promoting calm, promoting safety, promoting self-efficacy and collective efficacy, meaning that you can encourage people that they can do things. They can establish some of their normal routine even in the midst of a disaster. And then connection is a part. And then finally, hope, letting people know that things can and will get better.
There are so many elements to this. How do we really facilitate that comprehensive response after a natural disaster like this?
Well, I think it's so important for the local and state level to be involved. The emergency management agencies and departments of mental health and behavioral health for the states and localities. Of course, FEMA is very important. I think we need to be very proactive in letting people know in advance. We should not be waiting until a disaster to let people know about these sorts of supports. And of course, the funding is critical.
And that gets back to your key focus, and that is connectedness. Is there anything that is perhaps the most important to start and begin to get that sense of connectedness back after a natural disaster?
You know, I think one part of it is making sure our communities are not forgotten, raising that awareness, and also ensuring that disaster professionals are diversified. At this point, they really are not. They are very much in the minority, and we know that those disparities are connected to the dearth of disaster professionals.
Such an important topic, so many tentacles. Thank you for all you do, Dr. Annelle Primm.
Thank you.
Now to the first of our visits to organizations tackling health equity in our country. It is Stanford Medicine.
Health equity and healthcare disparities have been a focus of our work for many years. However, the COVID-19 pandemic has really highlighted the need for more work in this area.
We believe that building bridges between our academic institution and community health centers is key to health equity.
A lot of the health disparity research that currently takes place, it's really important for us to center the voice of those that are being researched.
I feel like this work is important to me because someone that came from a low income, underserved community in the Central Valley, it's really important for me to give back to my community and just pay it forward.
My frustrations with healthcare and also seeing the patients in the free clinics have motivated me to want to really address healthcare disparities and social determinants of health in the clinical setting.
It is through our differences that we can improve healthcare delivery for everyone, and that is the goal of our work here at Stanford.
Now to the Center for the Study of Racism, Social Justice, and Health at UCLA, whose faculty have been committed to the study of racism as a barrier to health equity for over a decade.
Racism is a public health problem. Disparities occur along the lines of race and ethnicity very systematically. I launched the center on the inaugural Indigenous Peoples Day. I wanted to create a space that was really a hub both a hub for research and critical race theory informed action in public health and in community, so that we could be self-reflexive, thinking about how we do our work in public health and leading the field in addressing social inequalities. The COVID pandemic has really been laying bare for us the ways that no dimension of our society is really free from. I think about public health as leading solutions to racism in our society.
We are almost through here at APHA TV, but before we go, we wanted to know what you've enjoyed most here at APHA 2021.
I think the biggest thing that I am enjoying is the young up-and-coming professionals. They're so full of energy. They have done amazing work to contribute to our field of research on just a huge range of topics.
Just reconnecting with our community of public health advocates and champions. Heather McGee was amazing. I read her book last year, so it was great to see her in person. And also Elizabeth Valpierre, who's an activist, environmental justice activist in New York and Brooklyn. Just heard her this morning, so super fired up.
Well, being my first time at APHA, I really enjoyed the networking and celebration together as we dug through some of these hard concepts and things that we're facing right now that we're trying to overcome.
Biggest thing that I appreciate about this conference is how they made it a safe conference for us during a COVID-19 pandemic. I really appreciate all the efforts requiring the vaccinations, requiring the social distancing to provide protection for all of us to the best that they could. And I really think it's been successful because they have been able to do that. We were still able to get together and enjoy each other's company safely.
Next up, we go to the Center for Educational Disparities Research, an interdisciplinary research center that is seeking to understand disparities in education and health.
The Center for Educational Disparities Research at Penn State is focused on understanding and addressing educational health disparities.
I think of the Center for Educational Disparities Research as a hub that basically brings independent researchers who are working on topics that kind of looks at the intersection of educational and health disparities.
We've been investigating racial and ethnic disparities and disability identification in childhood. So we've tried to contrast children who look observationally similar, including in clinical need.
We find that these disparities are persistent.
And there's a huge need to ensure that we address the disparities in educational outcomes for that group of students.
We are now delighted to be joined by former U.S. Assistant Secretary for Health and the 16th Surgeon General of the United States, Dr. David Satcher. Thank you for being here. I'm honored to meet you, certainly. You have been dogged in your pursuit for health equity. So I want you to tell me, in your perspective, how far we've come, and perhaps more importantly, how far we still need to go.
Well, thank you. I have tried to be dogged, and because as you probably well know, I almost died of whooping cough when I was about 1.5 years old. And that story, was told to me over and over again by my mother and others. There was one black physician in Anniston at that time. So I grew up determined that I was going to try to make a difference in that area.
And you have, certainly, and in your book, which is, My Quest for Health Equity. When people read that, what do you hope they take away?
Well, number one, there's hope, because, I've come a long ways in this quest. I mean, I've helped a lot of other people along the way. I've motivated a lot of young people to go into medicine and nursing and public health and areas like that. So I think that's the most important thing we can do in the quest, is to keep building a core of people. Secondly, you need to know enough. You need to really know the facts and to know where the opportunities for intervention are. Thirdly, you have to have the courage to act. And as you probably know by now, as a student at Morehouse, I virtually took a chance of giving up my career in order to go to jail when we could not eat in restaurants. There was only one restaurant, I believe, in Atlanta at the time that would serve blacks. So we, the students, decided that we were going to intervene, even though it meant going to jail, and in one case, prison. And finally, you have to be willing to persevere. And you can imagine, at my age, I've done a lot of persevering. Yeah, but I've been fortunate, and hope that other people will not, have to fight the same battles again. Even though obviously we're not there yet, we've come a long way.
You're such an inspiration, I think, because you began that leadership role, as you mentioned, back in college, and then a pioneer in your career as well. In that knowledge, you know some of the greatest challenges. What would you say they are, and what would be your advice to try to overcome them as we move forward?
Well, obviously you have to say that one of the greatest challenges is making sure that we keep generating interest in medicine and public health, that we keep motivating young people to go into these fields, and that we keep supporting them. One of the problems we have, of course, is, as you well know, African Americans are greatly underrepresented in the health professions. We're making some progress, and we have to keep making that progress. So we have to motivate young people. We have to get them interested in, quote, STEM careers, and because some of them think, well, that's not for me. Well, we can change that, and that's what we're trying to do, is to show that we can change it.
You broke through so many of those barriers. If you look back now, are there things you would have done differently, or is there advice to people that you say from the lessons that you've learned?
Well, I would have to say that I've been very fortunate, and therefore it's very difficult for me to complain about what didn't happen. Neither of my parents finished elementary school. However, they were very supportive of their children's education.
Well, you are such an inspiration, Dr. David Satcher. Thank you so much for sitting down with us and taking the time to talk with us.
Enjoyed it. Thank you.
The Johns Hopkins Center for Public Health and Human Rights focuses on the intersection of public health and human rights by using cutting-edge population sciences. Let's take a look at what they're working on.
What we're seeing, unfortunately, all over the world is a rising number of human rights violations, and not just against individual activists or dissidents, but against populations and whole communities. This public health and human rights work, where both rights violations and the health of populations is threatened, is enormously challenging work. I'm incredibly proud of our faculty and staff and students who engage in this work, and we really feel that it's essential for scientists and public health people to be there. Our vision is that whenever public health interventions are undertaken, that human rights considerations will be at the heart of those efforts, and also that the human rights movement will gain traction, credibility, and heft from the use of these scientific public health tools.
Well, that is it for another exciting year at the APHA Annual Meeting and Expo. There is plenty to take away and plenty to implement as we continue to work toward creating the healthiest nation. Remember, if there's anything you've missed or want to share, there are plenty of ways to watch the show. Right here in the Colorado Convention Center, in select hotels, always on the virtual platform, and of course, you can find us online. APHA TV will remain online all year round, so even as you head back home, make sure to take a look. That's it from us. Until next year, stay safe and keep up the great work.